I'm Stephanie Rummel, and I was a patient here at Kindred Hospital. I was at home sleeping. It was right after Christmas, and I woke up in the middle of the night coughing and just non-stop coughing and having the toughest time breathing. So my dad quickly called 911 and they took me to the hospital, and I got admitted, and I was on 2 different sources of oxygen at the max they could go and was still having trouble breathing.
So Stephanie came to us from Dallas, so she had a very challenging illness in the form. She had a bad lung disease, and associated with it she also had a bad kidney disease. So per se, if you look at each one of them, she'll require an organ transplantation. We decided to offer her a dual lung and a kidney transplant. If you look at numbers as such, there are only a handful which are done in this country every year. So she's a very unique patient. She's been in the hospital a long time. She lost a lot of muscle mass and strength, and she was completely ventilator dependent. And that's when we brought her to Kindred, and the whole idea was we're gonna pursue the transplant evaluation and also do some reconditioning, get her stronger so that she would be able to handle this surgery.
Stephanie was here for pre-transplant so that she can get conditioning as well as respiratory therapy and nutrition.
I only ended up waiting maybe 3 weeks, maybe, until finally got the call saying that they found matches for both my lungs and my kidney.
She was transferred to Methodist Hospital to undergo a bilateral lung kidney transplant, where her course was complicated with remaining on the ventilator as well as nutrition and deconditioning. She came back to Kindred because that is what we specialize in, is vent management, physical therapy, as well as nutrition.
These patients usually require a lot of support to recover from that acute illness, which is very scientifically proven, and that's where Kindred comes into play. The way I look at it, essentially, is it's a hospital to help you recover from acute issues and transition you back to home, and that's where Kindred plays a role compared to a pure acute care hospital.
My goal was to walk again, of course, which it took some time, but I eventually got it. And then the biggest goal was to get me off of the ventilator. I thought I couldn't live without that ventilator, so it was rough getting off of it, because that's basically all I knew for the longest time was that ventilator. And in my head, if I didn't have the ventilator, how was I going to breathe again, you know?
Vent weaning was a challenge. Many a days I had to sit by her bedside as we weaned her and make sure everything was okay.
We were able to wean her off the ventilator. We were able to wean her off her breathing treatments. We were able to successfully wean her off the oxygen, which is sometimes very difficult with these lung transplant patients.
Eventually got over my fears and strong enough to where I could breathe on my own and do everything on my own without needing the help of the ventilator or the trach eventually. So then I was free from it all, and I felt so much better once it was all off and I was breathing on my own.
Respiratory therapy was really an integral part of her getting better and really just walking out of here.
I've been more active, I've been eating more, I've been out shopping, just talking with friends, basically back to my normal life.
To see that such a sick girl stay with me for so long and then come back and recover and doing well, it's all I need.
If it wasn't for Kindred, then I would probably still be in the hospital, just because they were so on point with like the physical therapy and the respiratory therapy and the occupational therapy. They want what's best for you, and their goal is to get you out to have your life back.